Hi, my name is Dr. Kikie Gardner. In this video, I'll be going through fatty liver, what it is, why it happens, ways to prevent and reverse this condition naturally. I'll let you know some of the fastest ways to reverse fatty liver, the foods to eat and the foods to avoid. This is a side-by-side picture of a normal liver and a fatty liver. And as the name suggests, fatty liver is caused by too much fat in your liver cells. Did you know that fatty liver disease is becoming increasingly more common, affecting 1 in 4 people worldwide? This is a scary statistic, and this disease is on the rise, partly due to the increase in the obesity epidemic and the rise of metabolic conditions like diabetes. So why is fat in the liver so bad for you? When fats are stored in fat cells or adipocytes, they don't cause too many problems. But when fats are stored in places that they're not meant to be stored, like your liver, then you can run into problems. Think of it like using your car keys to open your front door. It just wouldn't work, would it? And you'd probably be doing more harm than good. Your car keys belong with your car, just like fats belong to fat cells, not your liver cells. If the fat cells in your liver start to build up, this can lead to inflammation, which can destroy the liver, leading to scarring. The liver isn't then able to do its job of removing toxins from the body, and this can give rise to symptoms like fatigue, feeling unwell, and pain in the right side of your abdomen. 40 years ago, this condition was virtually unknown. So why has it become so common? Before we understand how to treat fatty liver, we need to understand what causes it in the first place. Fatty liver disease is caused by having too much sugar in your diet, in particular sucrose and fructose. When your body takes in sugar, the hormone insulin is released, which helps to store this energy as fat. Sucrose or table sugar is broken down into glucose and fructose. Glucose is the main sugar that's found in foods that are high in carbohydrates, like potatoes, rice, wheat, and bread. Fructose, on the other hand, is the sugar that's found in fruits, honey, and some root vegetables. The liver is the only organ in the body that can use fructose as a form of energy. All the other organs in the body, like your brain, your heart, your kidneys, can all use glucose, but the liver is the only organ that can use fructose as a form of energy. When you have excess fructose in your diet, it gets stored as fat, and that fat starts to build up in your liver. So, am I saying that we should stop eating fruits and vegetables? Of course not. Humans have been eating fruits and vegetables for thousands of years, but fatty liver disease only started becoming a problem when we started having manufactured sucrose and fructose in high quantities. Fruits and vegetables, in their natural state, contain fructose, but here's the difference. They also contain a lot of fiber, water, and nutrients, so they take a while to digest. This helps to slow down the amount of fructose that your body absorbs. There are certain foods that can contribute to fatty liver disease, so it's important to avoid them in our diets. High sugar foods such as fizzy drinks, sugary drinks, processed snacks, biscuits, cakes, all contribute to the development of fatty liver disease. Now, we all know about avoiding fizzy and sugary drinks, but juices are often advertised as being very healthy. Don't fall into that trap of thinking juices with no added sugar or juices with natural sugars are healthy. Simply put, all fruit juices contain high levels of sugar. Whether you're having apple juice, orange juice, cranberry juice, they all contain high levels of sugar. For example, take this 8-ounce cup of pure apple juice. That's the equivalent of 3 medium-sized apples. And that's roughly just under 8 teaspoons of sugar. I'll show you what that looks like. 1, 2, 3, 4, 5, 6, 7, and just under 8. This is what you're having each time you're having a glass of apple juice. Dried fruits are also foods to avoid. Why? Well, yes, they're natural, but because all the water's been taken out of them, what you're left with is a high concentration of fructose. The other thing that we should be concerned about is glucose. Having a diet that is high in carbohydrates is bad for fatty liver disease. So now we know that too much glucose and fructose lead to fatty liver disease. So it makes sense that to prevent or treat fatty liver disease, we need to avoid glucose and fructose. There's good research to show that with the ketogenic diet, low carb diet, and intermittent fasting, fatty liver disease can be reversed. Now, although non-alcoholic fatty liver disease is not caused by drinking alcohol, it's best to avoid alcohol altogether, as that can make your liver work even harder. In addition to watching what we eat, regular exercise can play a crucial role in reducing fatty liver disease. Regular physical activity can help reduce the amount of fat in the liver and improve overall liver function. Aim for at least 30 minutes of moderate exercise most days of the week. This can include activities such as walking, swimming, or cycling. Exercise not only benefits our liver, but it also improves our overall health and well-being. Now, another thing to consider is managing your weight. Being overweight or obese increases your risk of developing fatty liver disease. By maintaining a healthy weight through diet and exercise, you can reduce your risk of developing fatty liver disease. And finally, it's really important that you avoid using medications or supplements that can harm your liver. Always speak to your healthcare provider before starting any new medications or supplements. So, in summary, there are several steps that we can take to reduce fatty liver naturally. By focusing on a healthy diet, maintaining a healthy weight, and regular exercise, we can improve our liver health and reduce the risk of fatty liver disease. Let's all make a commitment to taking better care of our livers. Our livers work very hard for us every day, so let's show them some love. Do you have fatty liver disease? Or have you implemented some of the steps that I mentioned before? Drop a comment below.